All right, let's jump right in. Today, we're going to do a deep dive into Indian healthcare.
Okay.
And specifically, we're looking at two big companies, Aster DM Healthcare and Fortis Healthcare.
Right.
And the idea is to figure out, like, you know how they compare financially? How are they doing operationally?
Exactly.
And we're basing all this on their FY 2023-24 annual reports.
Perfect.
So we're really getting down into the nitty-gritty.
Yeah, love it.
And I think a lot of our listeners are really interested in kind of quickly understanding,
Yeah,
like, what are the main differences between these two companies?
absolutely.
You know, like, are they both doing well? Are they struggling? What's going on?
Right.
And just looking through these reports, I'm seeing some really interesting things.
Okay.
For example, Aster is, like, they're going all in on expanding their bed capacity in India.
Wow.
Yeah. And they're planning to add almost 1,700 beds in the next 3 years.
That's ambitious.
It is. And they're really focusing on these brownfield projects, which is basically expanding existing facilities instead of building new ones from scratch.
Makes sense.
Right. It's like, why are they doing that? We'll get into that.
Yeah.
But then on the other hand, you have Fortis, and they're like all about the digital initiatives
Okay.
and specialized care.
Interesting.
Yeah, they're talking about these AI-powered cath labs.
Really?
Yeah, and they're integrating with the Ayushman Bharat digital mission, which is like India's big
Wow.
national digital health ecosystem. So
It's like they're building the hospital of the future.
yeah, it's very high tech, very forward-looking.
I like it.
So right off the bat, we're seeing these two very different approaches.
Yeah.
But before we get too deep into the weeds on that, let's just like take a step back
Okay.
and just establish a baseline.
Sure.
What did these reports tell us about, like, the raw financial capacity
Okay.
of these two companies?
Yeah, let's start with that. So looking at the numbers, Fortis is actually reporting higher revenue and EBITDA compared to Aster. Yeah, in FY 2023-24, Fortis came in with a revenue of INR 693,117 crores and an EBITDA of INR 1,306 crores.
Okay, so Fortis is bringing in more money overall.
Exactly.
But what about, like, profitability? How efficiently are they using that money?
Right, so that's where EBITDA margins come in, and this is where it gets interesting.
Okay.
Both companies actually saw their EBITDA margins increase, which means they're both becoming more profitable.
That's good.
It is. Fortis reported an EBITDA margin of 18.9%, which is up slightly from the previous year.
Okay.
But Aster's report didn't actually specify their EBITDA margin.
Oh, interesting.
Yeah, but they did mention a 17% increase in their PAT, their profit after tax.
Okay, so they're both making more money, but Fortis is giving us more details.
Yeah, it seems that way.
Okay, so we've talked about money, but let's get back to those different strategies.
Yeah.
You mentioned Aster's, like, big expansion plan.
Right.
Can you tell me a little bit more about what exactly they're doing?
Yeah, so Aster is really investing heavily in expanding their capacity in India. They're putting in a significant INR 392 crores in capital expenditure.
Wow.
And a large chunk of that, about 60%, is going towards those brownfield projects we talked about.
Okay, so they're really committed to this idea of expanding existing facilities.
They are.
Okay, but what does that look like in practice? Like, what specific projects are they working on?
Well, they've got some big ones in the pipeline, like a 454-bed hospital in Thiruvananthapuram,
Okay.
a 264-bed facility in Kasaragod,
Wow.
and a major expansion of their existing CMI hospital, which will add another 350 beds.
So they're not messing around.
Nope, they're going big.
All right, so Aster's all about bricks and mortar. What about Fortis? What's their growth strategy look like?
So Fortis is, as we said, leaning heavily into digital innovation and specialized care.
Right.
They're investing in those AI-powered cath labs, which is pretty cutting edge.
Yeah.
And they're deeply integrated with the Ayushman Bharat digital mission, which is a massive undertaking, to create a unified digital health infrastructure for India.
So they're really trying to, like, revolutionize the patient experience through technology.
Exactly. They're looking at the whole picture, not just the physical facilities.
Okay, so we have two very different approaches to growth, but growth always comes with risk.
Of course.
So how are these companies managing that risk?
Well, Aster has a very structured approach. They emphasize a 5-step risk management framework.
Okay, so they're very systematic.
Very much so. They identify, measure, manage, monitor, and communicate risks at every level of the organization.
This is thorough.
It is. They're not leaving anything to chance.
And what about Fortis? How are they approaching risk management?
Fortis takes a different approach, focusing on ESG principles.
The ESG, remind me what that stands for again?
Environmental, social, and governance factors.
Right, right.
So they're looking at things like energy and water efficiency, waste management systems, all that.
So they're building sustainability into their business model.
Exactly. They're thinking long term about the bigger picture.
I like that. Okay, so we've talked about their financials, their growth strategies, their risk management.
Yeah.
But how are these companies actually performing on the ground?
Right. We need to look at the operational KPIs.
Exactly, those key performance indicators.
Things like bed occupancy rates, patient satisfaction scores, employee engagement levels.
Right, give us the inside scoop.
Okay, well, the reports give us some interesting data points.
All right.
Aster's report, unfortunately, didn't provide specifics on bed occupancy rates or patient satisfaction.
Interesting.
Yeah. But they did highlight their achievements in advanced medical procedures like organ transplants and robotic surgeries.
Okay.
They did over 510 transplants in FY 2024, which is up from the previous year, and over 1140 robotic surgeries.
Wow, so even without those specific metrics, it seems like they're attracting patients who need very specialized care.
It seems that way.
And what about Fortis? What kind of operational data are they providing?
Fortis did give some concrete numbers, like their overall bed occupancy rate, which increased slightly by 0.21%.
0.21%. Is that good? Is that bad? What does that even mean?
That's a great question, and it's hard to say without knowing the industry trends and how their competitors are doing.
We need more context.
Exactly, but it is a data point to consider.
Okay, what other operational KPIs are jumping out at you from the Fortis report?
Well, one thing that really stands out is their focus on employee engagement.
Oh, yeah.
Yeah, they launched leadership programs and did an employee engagement survey with a whopping 96% participation rate.
Wow, that's impressive.
It is. And their Employee Net Promoter Score, or ENPS, saw a significant jump of 33%.
So they're creating a positive work environment, which hopefully translates to better patient care.
Exactly. Happy employees, happy patients.
Makes sense. Okay, so we've covered a lot of ground here.
We have.
We've looked at their financials, their growth strategies, their risk management, their operational performance.
It's a lot to take in.
It is, but now I think it's time to kind of like zoom out a little bit and talk about the big picture. Like, what are the strengths and weaknesses of each company based on everything we've seen?
Yeah, let's do that. So with Aster, I'd say their strengths are their clear capital allocation strategy for growth in India,
Right.
their focus on efficient capacity expansion, especially through those brownfield projects,
Right.
and their very robust risk management framework. They seem to have a solid plan for tackling the Indian healthcare market.
It does seem like they're very strategic and methodical in their approach.
Absolutely.
Yeah.
But on the flip side, one weakness that stands out is the lack of specific data on key operational KPIs like bed occupancy and patient satisfaction.
Right. They're holding back on some of those details.
They are, and that makes it harder to assess their day-to-day performance.
Okay, fair enough. Now, what about Fortis? What are their strengths and weaknesses?
For Fortis, I'd say their strengths lie in their focus on digital initiatives and specialized care.
Oh,
Their proactive approach to ESG principles.
right. They're not just thinking about profits.
Exactly. They're thinking about the long-term impact.
I like that.
Their high employee engagement levels, which we talked about, and their attention to patient satisfaction. They seem to be building a culture of excellence.
They're definitely checking a lot of boxes.
They are. But one weakness that jumps out is the lack of detailed financials for their diagnostics business, Agilus.
Oh, yeah. It's like they're being a little secretive about that part of their business.
It does seem that way, and it makes you wonder why.
Yeah, maybe we'll uncover that mystery later.
Maybe so.
Okay, so we have two very different companies with their own unique strengths and weaknesses.
Yes.
And I think what's really interesting is how they both seem to recognize that healthcare is changing.
Absolutely.
It's not just about providing beds and medical procedures anymore.
Right.
It's about creating a holistic experience for the patient.
A whole new world.
It is. And using technology to empower both patients and medical professionals.
It's exciting to see how they're both approaching these challenges.
It is. And I think it begs the question, which approach is ultimately going to be more successful?
That's the million-dollar question, isn't it?
It is. And that's what we're going to try to figure out as we continue this deep dive.
Can't wait.
Me too.
So where do we go from here?
Well, I think we need to delve a little deeper into those operational details.
Okay.
Really understand how these strategies are playing out on the ground and what that means for patients.
Sounds good to me.
Let's do it.
Let's get into it.
All right. So after a quick break, we're going to come back and we're going to really dissect those operational KPIs
Okay.
and figure out, how are these companies actually performing?
Can't wait.
Stay tuned. Okay, so we're back, and we're really getting into the heart of this comparison between Aster and Fortis.
Yeah, it's fascinating to see these two different approaches play out.
Right, it's like they're both trying to solve the same puzzle,
Hmm.
but with totally different strategies.
And both strategies have their merits, for sure.
Absolutely.
Right.
But, we've talked a lot about the theory, the financials, the plans.
Right.
Now I want to see the results.
Yeah, let's get down to brass tacks.
Exactly. How are these strategies actually impacting their operational performance?
Well, that's where things get a little tricky, especially with Aster.
What do you mean?
Remember how their annual report was pretty vague on some of those key operational KPIs?
Yeah, they didn't give us much to work with on things like bed occupancy rates and patient satisfaction.
Exactly, which makes it hard to gauge how efficiently they're running their hospitals.
So we're kind of left to speculate based on what they did choose to highlight.
Right, and they chose to emphasize their achievements in complex medical procedures.
Like those transplants and robotic surgeries.
Exactly. So, while we don't have concrete data on their overall operational efficiency, we can infer that they're attracting patients with complex needs and investing in advanced technologies.
Okay, so maybe they're sacrificing transparency for a bit of strategic mystique.
Maybe so, but it would be nice to see those numbers.
Agreed. All right, what about Fortis? Did they give us a clearer picture of their operational performance?
They did provide some specific figures, particularly on their bed occupancy rate.
Right, but it was just a tiny increase of 0.21%.
Yeah, and as we discussed earlier, it's tough to interpret that without industry benchmarks.
We need more context.
Exactly.
Okay, but besides that, what other operational insights jumped out at you from the Fortis report?
Well, one thing that really impressed me was their focus on employee engagement.
Oh yeah, their EMPS score went way up.
It did. A 33% increase is nothing to sneeze at.
And they had a huge participation rate in their employee engagement survey.
96%, which is pretty incredible.
Yeah, it shows they're really invested in creating a positive work environment.
And that's so important, especially in healthcare.
Absolutely. When employees are happy and engaged, it translates to better patient care.
It's a win-win.
So kudos to Fortis for prioritizing that.
Absolutely. Now, remember, we also talked about some potential weaknesses for both companies.
Right. No company's perfect.
Exactly. So, on the Aster side, that lack of transparency regarding specific operational KPIs still nags at me.
It's like they're showing us the finished product, but not letting us see how it's made.
Exactly. We're left wondering how efficient they are behind the scenes.
And for Fortis, I'm still puzzled by their reluctance to provide detailed financials for Agilis, their diagnostics business.
Yeah, that's a bit of a black book.
It makes you wonder what they're hiding.
It does. But maybe there's a strategic reason for it.
Maybe they're planning a big move with Agilis and they don't want to tip their hand.
Could be.
Yeah.
Now, while we're on the topic of external factors, we should probably talk about the role of government policies and initiatives in all of this.
Oh, yeah, good point.
Wow.
We've been so focused on these two companies, we haven't really considered the bigger picture.
Exactly. And the Indian government is playing a huge role in shaping the healthcare landscape.
For example.
Well, the Ayushman Bharat program is a major game changer.
Right, that's the one that aims to provide health insurance coverage to millions of low-income citizens.
Over 500 million, to be precise.
Wow, that's a massive undertaking.
It is, and both Aster and Fortis are actively participating in it.
So they're aligning their business goals with national healthcare priorities.
Exactly. It's a smart move.
And don't forget about the Ayushman Bharat digital mission.
Right. That's the initiative to create a unified digital health infrastructure for India.
And Fortis is all over that.
They are. They see it as a key part of their growth strategy.
It's interesting how these government programs are influencing the direction of these private companies.
It's a fascinating dynamic.
It is.
Okay.
So we've talked about the companies, their strategies, their performance, the government's role.
A lot of moving parts.
There are,
Yeah.
but now I want to bring it back to the most important stakeholder in all of this, the patient.
Yeah. Ultimately, that's what matters most.
Exactly. So how do all of these factors, all of these strategies impact the average person in India seeking healthcare?
Well, on the positive side, Aster's expansion plans, particularly their focus on brownfield projects, could mean greater access to quality healthcare, especially in underserved areas.
So more people will have access to care closer to home.
Exactly, which is huge.
And what about Fortis? How could their approach benefit patients?
Well, their emphasis on digital innovation could lead to faster, more accurate diagnoses and treatments.
Okay, so better outcomes for patients.
Potentially, yes. And their specialized centers of excellence offer access to top-notch expertise in specific areas.
So if you need specialized care, Fortis is the place to go.
That's the idea. But, of course, there are potential downsides, too.
Right, nothing's perfect.
With Aster, there's always the risk that rapid expansion could lead to quality control issues.
If they grow too fast, they might not be able to maintain standards across all their facilities.
Exactly. And their focus on brownfield projects could limit their ability to adopt completely new healthcare models.
So they might miss out on some cutting-edge innovations.
It's a trade-off they're making.
And what about the potential downsides of Fortis's approach?
Well, their reliance on technology could backfire if those systems are unreliable or vulnerable to cyber attacks.
Right, technology is great until it's not.
Exactly. And their focus on specialized care might come at the expense of more general healthcare needs.
So they could end up neglecting some basic services.
It's a possibility.
Okay, so both companies have the potential to make a real difference in people's lives.
They do.
But they also face challenges in ensuring quality, accessibility, and affordability for everyone.
It's a complex landscape.
It is. And I think that's what makes this comparison so fascinating.
Agreed.
It's not about declaring a winner or a loser.
Right.
It's about understanding the different approaches, the trade-offs, the potential benefits and risks.
And ultimately, it's up to each individual to decide which approach resonates most with them.
Exactly. So as we head into the final part of this deep dive, I want to encourage our listeners to really think about what matters most to them in healthcare.
What are their priorities? What are their hopes for the future of healthcare in India?
Because those answers will help them decide which company's vision aligns most closely with their own.
And hopefully, this discussion has given them the information they need to make that informed decision.
I hope so. Let's take a quick break and then we'll come back and wrap things up. Okay, so we're back, and it's time to really answer the big question.
Yeah, the moment of truth.
Which company's approach is more compelling? Aster or Fortis?
Right. We've looked at all the data, all the strategies.
We've gone deep.
Now it's decision time.
It is. So just to recap, we've got Aster, who's all about expansion, boots on the ground, making healthcare more accessible.
Very strategic, very methodical.
Right. And then we've got Fortis, embracing the digital revolution, AI, specialized care, the whole 9 yards.
And really pushing the boundaries of what's possible in healthcare.
Right. So 2 very different approaches, but both aiming for the same goal: better healthcare in India.
Absolutely. So for our listeners out there, which one resonates more with you?
Yeah. Which vision of the future speaks to you?
It's a tough choice, I know.
It is. It's like comparing apples and oranges, you know.
But both are fruits. Both are good for you.
Right. Both have their own unique benefits.
Exactly. So it really comes down to your individual priorities, what you value most in healthcare.
Like if accessibility is your top concern.
Then Aster's focus on expanding their reach, especially in underserved areas, might be more appealing.
Right. They're all about bringing quality care closer to people.
Making it more convenient, more affordable.
But if you're really excited about the potential of technology to transform healthcare,
Then Fortis, with their digital initiatives and cutting-edge technologies, might be more your speed.
right, they're really pushing the boundaries of what's possible.
And let's not forget their commitment to ESG principles.
Yeah, that's a big differentiator,
They're showing that you can be profitable and responsible at the same time.
which is something I think a lot of people care about these days.
Absolutely. So as we wrap up this deep dive,
Yeah.
we encourage you to really think about what matters most to you in healthcare.
What are your hopes for the future?
Which company's vision aligns most closely with your own?
Because ultimately, the choice is yours.
It is. We've given you the information. Now it's up to you to decide.
And we hope this discussion has been helpful in making that decision.
Yeah, we've tried to present a fair and balanced picture of both companies,
To show you the strengths and weaknesses of each approach.
so you can make an informed decision.
Right. Because at the end of the day, we all want the same thing.
A better, healthier future for India.
Exactly. And I think both Aster and Fortis, in their own ways, are working towards that goal.
They are. They're both playing a vital role in shaping the future of healthcare in India.
And it's going to be fascinating to see how it all unfolds.
It is. It's an exciting time to be following this industry.
Absolutely. So that's it for this deep dive into Aster and Fortis.
Thanks for joining us.
We hope you learned something.
And we hope you'll join us again next time for another deep dive into a fascinating topic.
Until then, stay curious, stay engaged, and keep asking those tough questions.
And most importantly, take care of yourselves.
That's right. We'll see you next time.